Today, I've chosen to speak upon the benefits of chemotherapy. Why, you ask? Because until a month ago, I had no clue about cancer. I walked around oblivious to the world where people are fighting for their lives every day. It's one of those situations where you're like, cancer has nothing to do with me, so I'll pretend it doesn't exist. Well, it has been exposed to me through an important family member. I remember the day that I got that phone call. I had just moved to Odessa and was out buying groceries. The news that my aunt has cancer stopped me in my tracks. The aunt that I have tons of pictures and memories of me and my sisters wearing dress-up clothes and spending countless numbers of Christmases at her house. The aunt who with every year I grew closer and closer to and formed an inseparable bond. A bond that was so strong it did not waver when she told me she did not want any form of treatment for her cancer. So today I'm going to talk about the benefits of chemotherapy. Finding out that my aunt has cancer and is refusing chemotherapy and treatment altogether got me on the tracks to looking and researching different procedures for her cancer. She's a little older and maybe she did not understand exactly all the benefits of chemotherapy. In these points, I'm going to make her what I would expect a doctor to explain to an uncertain patient with cancer. I'll explain what cancer is, how chemotherapy works within the body, how treatment works, and some of the side effects of chemotherapy. To begin with, many people should understand exactly what cancer is. Cancer is a disease caused by an uncontrolled division of abnormal cells in a part of the body. Now, there are many treatments you can take to help fight off cancer, such as chemotherapy, radiation therapy, targeted therapy, surgery, and many more. I have chosen to discuss particularly chemotherapy because it is one of the most common forms of treatment and is like a symbol that most people associate cancer with. Chemotherapy is one of the least invasive and attacks cancerous cells directly. It helps to stop cells from dividing and spreading. Chemotherapy can also attack cancerous cells in any part of your body. As a cancer patient, you may be scared of the idea of chemotherapy because of things you may have heard or seen on TV or from other people. You can take chemotherapy at home or as a pill, and you can also take sessions in a chemotherapy unit through an IV. Now, the sessions depend on the type of cancer that you have and the type of treatment that you need. When I toured the St. Luke's Hospital in Houston with my aunt, we spoke to a patient. She was on her last treatment and had a total of 8 sessions in a 6-month period. These sessions could last from a few minutes to a few hours. The Macmillan Cancer Support website described what a chemotherapy session was like. And during a session, you sit in comfy chairs, you don't feel anything during your treatment, and you are allowed to bring family and friends, and you're allowed to eat, drink, read, or sleep. You could use this moment to relax. Now, some of the side effects of cancer usually scare patients, such as nausea, hair loss, fatigue, or feeling sick. And if you do experience any pains or discomforts, there are things that doctors can do to counteract these effects. Increased risk of infections do happen, although not everybody experiences these pains. It depends on the type of chemotherapy that you have, and everybody reacts to things differently. I also researched some long-term effects of chemotherapy. I found an article titled The Disadvantages of Chemotherapy written by Ray Udon. In his article, Ray discussed some of the long-term effects of chemotherapy, including heart or kidney problems, lung tissue, nerve damage, and sometimes even infertility. Yes, these are some things that everyone deciding to undergo chemo should be aware of, but risks do come with literally everything that you choose to do in life. Heart and kidney problems can be managed. Infertility can be overcome through an adoption or surrogacy, and the chance to live a healthy life with your loved ones is worth the risk. Survivor Sally R. from CancerTreatment.com says she experienced some mental side effects from her chemotherapy, such as a lack of organizational skills and a lack of short-term memory. She's a 4.5-year cancer survivor, and I can't really give you any statistics about the survival rate of using chemotherapy because it does depend on the type of cancer that you have and the stage that your cancer has progressed to. But I do believe that these experiences are a small price to pay to live your life with your loved ones. Doing a chemotherapy treatment is better than doing no treatment at all. Finding out that my aunt has cancer made me not only think about my aunt's health and her well-being, but mine as well. I could be at risk to have the same cancer that she has. It seems like every time I talk to someone they know or them themselves have cancer. My aunt having cancer helped me open my eyes to a life that I may not be able to avoid. So learning about these different cancer treatments, such as chemotherapy, will allow me to become more knowledgeable about things I may have to face or that other people are facing right now. Finding out that you have cancer is not a death sentence. It is a chance for you to come together with your family and friends. You have to understand that doctors, nurses, and scientists are working hard to increase survival rates and eliminate cancer altogether. Giving up and having a negative attitude is shown to decrease your quality of life in an article from cancer.org. Tension, anxiety, and depression decrease your mental health, which interferes with having a positive attitude. And if you do start to have negative thoughts, it is okay, because cancer is an adjustment. But just know that there are family, friends, doctors, nurses, and support groups that want to help you feel comfortable and help you fight cancer. Thank you.